Good afternoon, everyone. My name is Adam Beswick. I am a master's student in the Department of Population Medicine at the University of Guelph. Very excited to be talking to you today about my project, which I've called Social Media Surveillance, using Twitter to track influenza in Canada. So a project that might be a little bit different than the other presentations today. So I'm going to be talking a little bit about influenza in Canada today. I'll also be talking a little bit about internet use and social media use among Canadians. Then I'm going to be telling you how I've combined those two ideas to come up with my own research, and then I'll share with you some of my preliminary findings. So I'm not going to go into too much detail about influenza, because I'm assuming if you're in this room, you're quite familiar with what influenza is, but obviously it's a respiratory disease. It affects 3 to 5 million cases of pretty severe illness every year, up to 500,000 deaths attributable to endemic influenza worldwide. In Canada, our influenza season runs from about November until April. And obviously it's a big concern and interest for research because of the potential for zoonotic disease outbreaks, especially a concern for both industry and public health. Can I just ask how many of you have gone on the internet today? How many of you have checked your email today? How about Facebook, Twitter, social media, LinkedIn? How many of you are checking Facebook right now? So that doesn't surprise me, because Canadians as a group use the internet much more than almost any other country in the world. 82% of us have some sort of social media account, as compared to 75% of Americans. Typically we spend about 41 hours a month online, and then if you do spend time online, chances are 91% of us have some sort of social media account. 56% of us own a smartphone being one of those phones that can connect to the internet and any of those social media sites. This is really exciting to me because it's a real big demographic that we can tap into as public health researchers. So as public health researchers, we do a really good job of capturing disease in the really young and the really old, but generally it's more murky in the 18 to 39-year-old range. Typically because if you're in that age range, you're probably less likely to go to the physician or go to the pharmacy and buy drugs if you get influenza. So I think that using these online tools are really a really exciting way to complement our current surveillance. Today I'm going to talk to you about Twitter, and if you don't know what Twitter is, I'm a little bit surprised, because 284 million active users of Twitter every month. There are 500 million tweets every single day. If you don't know what a tweet is, on Twitter, it's basically what they call a micro-blogging site, so people are able to post 140-character messages online to their friends and followers. There's been a little bit of research into using Twitter for public health surveillance before, so I'm not the genius that first came up with this idea. There's been a couple papers out of the States that have looked at specifically influenza surveillance using Twitter and seeing if Twitter can somehow inform surveillance. And they found that Twitter is actually can pre-predict some of the more traditional CDC reports about influenza surveillance. One thing that really excites me about Twitter, as compared to maybe some other online tools like Google search trends, is that we generally tend to tweet about ourselves. There's a certain narcissistic quality about Twitter, in that instead of looking for information, we're generally sharing information about ourselves. So this made headlines this week. This is the President of the United States apparently getting his own Twitter account. And he had 400,000 favorites, so obviously a big presence online already. What we use right now currently for influenza surveillance in Canada is a program known as FluWatch. So FluWatch is basically an aggregation of a whole bunch of different surveillance systems across the country. It's organized by the Centre of Immunization and Respiratory Infectious Disease, as well as the Public Health Agency of Canada, and they take a whole bunch of information, whether that be pharmacy sales, laboratory detections, hospitalizations, and records, basically put it all together and come up with a weekly report that reports on the influenza activity in localized areas across the country. So, from my own research, what I thought is that we really start to need to look at some of these online tools. So what I'm going to do is compare the historical Twitter traffic in Canada, and I'll go into what that means, to these FluWatch surveillance reports, basically treating the FluWatch surveillance report as our gold standard. Asking the questions, is influenza related to Twitter traffic? Is it associated with these endemic influenza patterns? Like I said, there are 500 million tweets posted every single day, so if you're going to use Twitter, I need to know what kind of words or key phrases are interesting and what kind of words and key phrases are useful in terms of tracking disease. And then can Twitter analysis identify an outbreak before maybe some of these other traditional surveillance methods, as has been shown down in the States? So what did I do? I looked at some Twitter data. So I chose 365 days. It's a full year long. From my knowledge, I think it's one of the longest studies of its kind. This is also the first study of its kind in Canada, as far as I'm aware, unless someone knows something that I don't. I specifically looked at Twitter keywords that were related to influenza, and I grouped them into 3 broad categories. So my first category was colloquial usage. So these are words that like my mom would use if she got the flu. So flu, Greek, which is our French word for flu, cough, fever, influenza, pneumonia, and then bird flu. I also included some preventative keywords, which include vaccine, Tamiflu, and flu shot. And I also included some zoonotic keywords as well, so swine, avian flu, and then different subtypes like H1N1, H3N2, H5N2, and H1N2. I worked with a company down in the States called GNIP. GNIP is a subsidiary company of Twitter, and basically they provide social media aggregation service to generally large business for marketing purposes. So I worked with that company and asked them to basically provide me data with all of those keywords that I just shared with you from within Canada over those 365 days. They were happy to oblige. They provide me with about 55,000 individual JSON files, each file containing tens of thousands of tweets. So that was quite a job to work through all of those files, and I won't even get into that because I could talk about that for quite a while. But basically I aggregated all of that data that they sent me, and then I also looked at the Flu Watch reports. In the Flu Watch reports, I picked up the information prior to the retroactive adjustments that Flu Watch does as the flu season progresses. So let's talk about the actual data that I acquired. So from my data, I had over 400,000 unique tweets. Every single tweet originated were from Canadian accounts. Vast majority of them were in English, so 96% English, 2% French, but we had 34 languages represented from all around the world. Like I said, 100% of the tweets were from Canadian accounts, but they didn't necessarily originate from within our borders. So 89% originated from within Canada, 9% from the United States, and then we had 1% of tweets coming from international vacation destinations. These are a geographic distribution of our tweets. So the graphic you're looking at right now, the blue lines represent where each tweet came from within the province. The red line is representing how we're actually distributed throughout this country. So overall, I was happy with the geographic distribution of our tweets. We had tweets from every single province and territory of this country. Generally followed a very nice trend in terms of our tweets representing where we're actually living, with the exception here of Quebec, which we're underrepresented in our sample, and that's obviously due to some language differences. We only included one French word among all of our keywords. So, like I said, I had over 400,000 unique tweets. This is the breakdown of how our keywords were distributed within those tweets. So, 32% of our tweets contain the word flu, 23% of them contain the word cough, fever was at 21%, vaccine, 8% of our tweets, and then we just go down the list here, as you can see. One thing I want to point out is that flu is obviously the most commonly used keyword, with 150,000 tweets containing the word flu. H1N2, we had 8 tweets for the entire year. So in fact, a lot of these really low numbers are associated with our zoonotic keywords of interest. So just something to keep in mind for you zoonotic influenza people is that generally the population isn't really talking about zoonotic influenza on Twitter. Here's how our tweets were distributed throughout the year. So in the back, if you can't see, on the very left side of this graph, I have August of 2013. On the very right side, we finish in July of 2014. So right in the middle of the graph, that represents January. That represents our peak influenza season throughout the year. So this is the aggregation of all of our tweets. As you can see, people are tweeting at different times of the year. And I'll go into some specific patterns for some specific keywords. This graph is representing our gold standard. So this is the Flu Watch report. I've aggregated all of the confirmed laboratory detections throughout the year. Again, the same on the x-axis here. So August 2013, July 2014. And then this big spike here is our flu season. And this year, it happened at the very end of December, very early January. So what I'm going to do now is I'm actually going to overlay some of the Twitter information on top of this red line. So every single graph from now on that has the red line, that's our gold standard. That's basically what I'm talking about when I'm saying the influenza activity in the country. So this first graph here, this red line obviously represents our flu activity in the country. This blue line represents when people tweeted the word flu in Canada. So as you can see, during our peak time here in January, it's following quite closely. I was very happy with this. So when we have peak influenza activity, we also have peak activity of people using the word flu. We also have people talking about flu in late October, early November here. Potentially due to flu shot, potentially due to people talking about the flu season. Lots of different ideas. But as you can see, it follows quite well. Before peak, we have some activity that isn't associated with actual flu, but anytime after January, it tracks very, very, very well. This is cough. So cough doesn't look nearly as nice. In fact, cough doesn't really track with our flu at all. And I'm looking at this and I'm going, what is going on? We have some people talking about cough in August. We have people talking about cough here in January, which is what we'd expect to see. But really, overall, it's not showing us, huge seasonality. And so I was thinking, why is this happening? What I really think, and what I'll show you, is that people tend to use the word cough in context other than talking about the cough. So I don't know if you've ever used the word cough when texting with your friends, but what about tweets like this? So for those of you who can't see this, it says, not dropping hints or anything, cough, cough, with a picture of an engagement ring. So that's one of the examples of people using these influenza-related keywords. It doesn't really have to do with anything to do with disease. Here's fever. Just like cough, it's following not really a clear trend. So we have, as you can see, we have pretty much a baseline here throughout the year. So between 2,000 and 1,000 tweets every single week containing the word fever. And I'm looking at this going, okay, it's pretty constant throughout the year, except that there's a big jump in July. Why are people using the word fever in July? Here's people using the word fever in January, burning up with a fever, not fun at all. Okay, so those are the tweets that I'm expecting to see. Then there's this big jump in July, and I'm going, what is going on? So I started looking at the tweets, and I started seeing tweets like this. Thought I was cured years ago, but I was wrong. My Bieber fever is back in full swing. So I'm getting Bieber fever, I'm getting dance fever, I'm getting cabin fever. I even got some Downton Abbey fevers, if you follow Downton Abbey. So again, fever, not one of those words that's going to be super useful in tracking with actual disease activity. I'm going to go through these relatively quickly because I'm running out of time. This is vaccine. Again, vaccine has a baseline, as you can see, throughout the year, but there's this clear spike in January. Great, so this is our French word for flu. Like our English word for flu, it's tracking quite well with a baseline, but there's this huge spike in January that correlates very, very well with actual influenza activity. Influenza following these same patterns. So as you can see, some of our keywords, not so good, but some of these other keywords are actually doing quite well in terms of tracking with actual influenza activity. Flu shot is the last one I'll show you. So flu shot again, the activity spikes with actual influenza activity. It follows our curve nicely down here. There's also big flu shot chatter right around the early November. So this, people talking about, I'm getting my flu shot, I don't think I'm gonna get my flu shot. This, people talking about, dang it, I should have got my flu shot. So let's summarize this quickly. Basically, I'm looking at what can influenza tweets tell us about actual disease in our population. So as I was showing you here, there is evidence that Twitter traffic is associated with seasonal influenza trends in Canada, but differences exist in the utility of different keywords. So choosing keywords needs to balance what I call the ubiquity of use and the specificity of use. And what I mean by that is the word has to be used enough to actually get enough data points for us. But it can't be used too much, so it'll introduce too much chatter. So fever is a good example of a word that's used a lot, but not very useful. Versus influenza, when people are using the word influenza, generally they're talking about the disease influenza. I'd like to acknowledge the Canadian Institute of Health Research, as well as the Ontario Veterinary Graduate Research Fellowship for the funding for this project, as well as my advisors Kate Dewey and Svonimir Polchak, Drs. Amy Greer and Andy Papadopoulos, and I'm happy to take any questions.
So I want to switch back to some of those slides because I think you have some, I think, better results here than you portrayed in some of those words, because what you're looking for is, like, particularly the ones about go back a couple slides. The ones that you think there was one chapter on, like fever.
Yeah.
So you can see the acceleration, that the change in the curve just before the fever or the
absolutely.
the red one takes off, like that, because you've got a decent piece of time where the line is essentially not changing. I bet you probably, that's a statistical analysis in the background that says, where it's starting to change.
Right.
So there, the change looks to be like a week or two before the fever one takes off.
Right.
You have to get this up a bit.
Yep.
That's not a bad. That's not bad. Like that's pretty good. Because I've seen a whole bunch of studies on Google Trend about this. You can analyze those to. They pour a lot of money to analyzing that. That's not a bad curve. So
Thank you.
Yes,
I also agree with that.
That's a terrible look at that particular word. But you need to do analysis about you can see the red curve starting to take off from 2 weeks. 2 weeks before it really starts to go up, and it's not clear whether the fever word is made or not. But
So absolutely. So I agree with you in that lots of these keywords have a lot of potential, and I didn't go into a lot of the stats that I'm doing because I thought I'd just show you some of the fun graphs. But you should come to my thesis defense, and I'll go into that really, really carefully. What I'm actually doing at the moment right now is I'm actually splitting the year into 3 distinct segments. So I'm going to do pre-influenza season, during the influenza season, and then post-influenza season. And I agree with you, especially with some of these keywords that don't show like the huge seasonality. I think if you just look at the 4 or 5 weeks in this region, I think that absolutely will look really good for even some of these keywords that aren't strongly associated. Yes?
Did you find with some of the words like fever and cough, there was a correlation with any other unrelated, like not really illnesses, but like say for instance seasonal allergies? Did you find that skewed results in any way that seemed to be a pattern?
So the question is whether I considered any other possible influences on disease, such as seasonal allergies and things like that. Absolutely, it could be associated. You can look at the fever cough. I think that you're probably right in that cough and fever don't show as strong of seasonal trends as influenza, so you might get more fever or more cough during the spring or something like that. So something that I absolutely could look at. For my project, I'm specifically trying to locate influenza-related keywords. That's only what I've been working on right now, but absolutely there could be other influences for sure. Yeah.
You've just analyzed words, small words, no? You haven't analyzed like trying to group like syndromic things like fever plus
cough or something.
Plus cough, for example.
Yep, so the question is whether I had considered combining different keywords instead of just using one keyword at a time. That's absolutely something I probably will be looking at in order to introduce more specificity in terms of that. Yeah, exactly. For sure. Don't have the results to show you on that yet, but absolutely that's something we'll be looking at. Yes?
Great presentation, by the way. I just have a question about getting the data from Twitter. I know it was all of Canada, I think you said. Are you able to get data for regions? So say Wellington got pretty well. You could ask for that kind of data that's that specific?
Yeah, so I'm going to say something that's probably going to scare you now. So the answer is yes. So when I got this data, the company provided the data based on location, based on if they put their location in their actual profile, and also based on longitude and latitude. So yes, for I would say probably about 85% of the tweets that I received, I had longitude and latitude coordinate locations down to 5 decimal points of where in the country it was tweeted from. So for example, I looked at a tweet from Peter Mansbridge. You all know Peter Mansbridge? So he tweeted a tweet about Tamiflu at one point. I was like, oh, Peter Mansbridge. So I looked into that Twitter information. I located where Peter actually tweeted that to a cabin in Quebec. So it freaked me out because I'm like, I'm not in the government. I don't need to know where all these guys are coming from. I just asked Twitter. I just had to give them some money and they're giving me all this information. So I have actually stopped using Twitter since starting this research. So anything you post online, trust me, way more information is being captured than you ever anticipated. So yes, I have location information. Yeah. Yes?
Can this system also be applied to looking for foodborne diseases seasonally?
Foodborne diseases seasonally. Yes, I hope so. I mean, the reason I'm looking at influenza is because there's been other projects that have looked at influenza. I see no reason why this can't be used for a whole plethora of diseases in the future. In fact, I think this is the way that surveillance is probably going to be going in the next 10 to 20 years. So yes, if you want to look at foodborne diseases with Twitter, come talk to me. That's a good idea.
Just to follow up a little bit on that, Chicago does that. They, the health department will do a scan, and when something comes up, they send them a message saying, "You've sent this. Do you want to talk to us about potential foodborne illness?" So there are those things.
Yeah.
I'm sure there are a lot of other questions, but we'll need to wrap up our time. And thank you very much for that presentation.